This conference will
Today
now be
we are
recorded.
taking the class on anatomy recall question, and it is to be taken by Dr. Rakshanda Ahmed, Part 1 MRCOG mentor. I'm Chief Mentor of the BEAT MRCOG, Dr. Yasmin Sayed. I'm taking the classes, okay? And the course fee is $350, but after discount it is $250. And if you will join class today, then you will get $20 discount. It will include complete course, material, classes, old classes, live classes, as well as the mock series. Okay. And this is more than enough to pass the exam. The people pass with the 82% of the marks only with the course. There's no need to read from anywhere, no source is required. And how much time is required? That is more than enough. You have time now. 2 to 3 months is enough to pass the Part 1 MRCOG. Part 1 MRCOG is the easiest step of the MRCOG. Part 2 is difficult and part 3 is doable. Okay. Now, what you have to do? First thing, part 1 eligibility deadline. That is, you have to send your MBBS degree or your registration. Okay. Copy through your account to the RCOG for eligibility. They will take 4 to 6 weeks, and it is last date is 29th August. Expression of interest, that last date is 9 September. You have to fill the form. If you will not receive your eligibility, still you can fill the form. So fill your form, okay? Booking window will open on 21st October. Remember, nowadays, because that is on VUE Center, so there's only few seats are there. So if you will do late, you will get in another city. So if you want to give exam in your city, it is best to do on the same day. Booking window close on 9 December. Exam date is 14 January and result date is Wednesday 11 February. Remember this, okay? Now I am giving the this to the Dr. Rakshanda Ahmed. She is going to take your anatomy class.
Hello, good evening everyone. I am Dr. Rakshanda and I will be taking the class. I have made some of the questions and each question has multiple choice questions. So you have to answer what is the correct answer. First question is, a Gardner cyst in the lateral vaginal wall originates from which embryological remnant? Option A is paramesonephric duct, option B is mesonephric duct, option C is urachus, option D is cloaca, and option E is allantois. So what is the correct answer? Please reply. Am I audible, Dr. Sadhya? Dr. Rita, please reply if I'm audible.
Yes, you are audible. Answer is paramesonephritic duct.
Yes, so the correct option is paramesonephric duct. Is the next slide visible to you?
No, same slide we can see.
Now is it visible?
No, same slide is still. Question number 1.
Now is it visible?
Yes.
So the correct option is mesonephric duct. So as we know that there is an apophron and paraophron, and uh, the Gardner duct arises from the mesonephric duct. So Gardner cells arise from the remnants of mesonephric Wolffian duct in the lateral vaginal wall. So I hope the answer is clear. Can we move further?
Yes, ma'am.
Okay, so the next question is the parturian gland is located in which anatomical space? Option A is deep perineal pouch. Option B superficial perineal pouch. Option C is ischioanal fossa. Option D is vestibular vagina. And option E is pelvic cavity.
Superficial perineal pouch.
Ma'am, is the question, is the answer visible? The correct option is superficial perineal pouch. Ma'am, is the screen visible to you? So the correct option is superficial perineal pouch. As we know that there is two pouches, one is the superficial perineal pouch and another one is the deep perineal pouch. The Bartholin gland, as you can see that there is a pair of urethra above the superficial perineal pouch, and this is the deep perineal pouch. The yellow one that you are seeing is the superficial perineal pouch. The violet one that is seeing is the deep perineal pouch, in which there is a pair of transverse perineal muscles. In between, there is a red line that is the perineal membrane that separates the superficial perineal pouch from deep perineal pouch. And what are the contents of superficial perineal pouch? It contains urethra, corpus spongiosum, and crus of penis. That is also known as corpus cavernosum. And the deep perineal pouch consists of transverse perineal muscle. So these are the these are the contents of superficial pouch. There is an ischio-cavernous muscle, bulbospongious muscle, clitoris, and bulb of the vestibule. So the Bartholin greater vestibular glands are located in the superficial perineal pouch near the vaginal orifice. So I hope the answer is clear. Now the obturator nerve is formed by which spinal nerve roots? Option A L1, L2, L3. Option B L2, L3, L4. Option C L3, L4, L5. Option D S1, S2, S3. And option
Answer B. L2, L3, L4.
Hello, am I audible?
Yes.
So what is the correct answer?
B. L2, L3, L4.
Yes, so the correct option is option B. So this is how there is a lumbar plexus that extend from L2, L3, L4, L5. As we have the brachial plexus in the shoulder joint, in the shoulder region, then there is a there is a lumbar plexus in our lower limb. So it starts from L2, L3, L4, L5 till S1. So L2, L3, L4 will form the obturator nerve. It will come from the obturator canal. Then it will divide into two branches. First is the anterior division and another one is the posterior division. An anterior division will supply which muscle? Pectineus, adductor brevis, adductor longus and gracilis muscle. And the posterior division will form obturator externus and adductor magnus. So I hope the answer is clear. Can we move further? If you have any doubt, you can ask me in between. So if they are there any doubt to you? Hello, am I audible?
Yes, you are audible. We can move
And
forward.
is there any doubt you can anyone can please raise your hand, and if any doubt is there, then I will clear. Now, at what vertebral level does the common iliac artery bifurcate? Option A is L1, option B L3, option C L4, option D S1, and option E S3.
C. L4.
Yes. So as we know that this is our abdominal aorta that extends from T12 to L4, and below and at the level of L4 vertebrae divides into two branches. One is the external iliac artery and another one is the internal iliac artery. So the explanation is the abdominal aorta bifurcate into common iliac artery at the level of L4 vertebra. So I hope the answer is clear. Can you tell me what are the branches of abdominal aorta? What branches will abdominal aorta will give? Anybody can? So it will give abdominal aorta at the level of L2. It will give celiac trunk. From celiac trunk, three branches will be going on. One is the right gastric artery, another one is common hepatic artery, and another one is duodenal artery. Then it another branch will come from superior mesenteric artery, and next one is the inferior mesenteric artery. So I hope the answer is clear. Now, next question is the upper part of the vagina receives its blood supply from which arteries? Option A is internal pudendal and obturator artery. Option B is uterine and ovarian artery. Option C is inferior gluteal external iliac artery. Option D is vaginal inferior vesical artery. And option E is superior rectal middle rectal arteries.
B. Uterine and ovarian arteries.
Yes, so the correct option is so these are the vessels of reproductive tract. Ovarian and uterine artery will supply the upper part of the vagina, while the lower part of vagina is given blood supply by. Can you answer, ma'am? Can you answer that
Inferior
lower
rectal
part of
artery.
vagina? Yes. So the upper part of vagina is mainly supplied by branches of uterine and ovarian artery, reflecting its close anatomical relation to the uterus and ovary. And ovarian branches, you have to remember that they are two. One is the ovarian artery, and another one is the. Okay, so can you tell me that which is the direct branch of abdominal aorta? There are two arteries. Can you please name? One I have tell you, and another one is. Ma'am, can you answer? One is the ovarian artery, and another one is the uterine artery. Ma'am, is the screen visible? Next question. Which nerve is primarily supplied by the perianal area? So option A is pudendal nerve, option B is inferior rectal nerve, option C is ilioinguinal nerve, option D is genitofemoral nerve, and option E is obturator nerve.
Inferior rectal nerve.
Yes. Ma'am, is the next screen visible? Ma'am, is the next screen visible to you?
No, same question 6.
So the correct option is option B, inferior rectal nerve. Yes, so this is the explanation. The pudendal nerve arises from the lumbar S2, S3, S4. Then it goes from the sacrospinous ligament that is present at our gluteal region. Then it will give three branches. First is the dorsal nerve of penis, then it's the perineal nerve, and this is the inferior rectal nerve. And these two branches, dorsal nerve of penis and perineal nerve, will form the pudendal canal. So the inferior rectal nerve is a branch of pudendal nerve which provides sensory innervation to the perianal skin and muscle. Now, next question is which artery is most commonly injured during appendicectomy? So option A is superior mesenteric artery, B is inferior mesenteric artery, C is deep circumflex iliac artery, D is inferior epigastric artery, and option is internal iliac artery. Answer. So the correct option is option C, that is deep circumflex iliac artery. The deep circumflex iliac artery runs around the iliac crest near the site of an appendectomy incision and can be accidentally injured during surgery. The embryological origin of trigon of bladder is from which structure? Option A is urogenital sinus. Option B is mesonephric Wolfram duct. Option C is paramesonephric Mullerian duct. Option D is allantois and option E is cloaca. So what is the correct answer? And please answer. Hello, am I audible? Am I audible to you, ma'am? Anybody can answer from these people. Ivan sir, Pooja ma'am, Rita ma'am, Sadia ma'am, Fauka Azam ma'am. So the correct option is the correct option is mesonephric, that is the Wolfram duct. Ma'am, is the screen visible? Next slide is visible. Ma'am, is the next slide visible? Ma'am, is the next slide visible? Please reply. So the correct option is mesonephric Wolfram duct. So this is the mesonephric duct. This is the yellow structure is posterior wall of the urinary bladder. So the trigon of the bladder develops from mesonephric duct while the rest of the bladder arises from urogenital sinus. The dermatome of the umbilicus corresponds to which spinal nerve? Option A is T8, option B is T9, option C is T10, option D is T11, and option E is T12. Answer please. Ma'am, please answer. Ma'am, please answer. So the option is option C, that is T10. So these are the dermatomes of thorax and abdomen: C4, T2, T3, T4. With at which level of T4 they are pair of nipple. Then T5, T6, T7, T8, in which the starting of the abdomen occurs, and at the T10 there is umbilicus. So the dermatome of umbilicus is T10, and at the level of L1 there is a penis. Now the next question is, the muscle which form the pelvic diaphragm is: option is levator ani and coccyx, option B is piriformis and obturator internal, option C is iliopsoas and psoas minor, option D is gluteus maximus and medius, and option is rectus abdominis and transverse abdominis.
Option C.
Sorry, ma'am, can you please further reply? I'm not. Ma'am, can you please reply again?
Option C.
Ma'am, your voice is not audible. Ma'am, can you be clear and loud? Your voice is not visible. Your voice is not audible.
Option C. Iliopsoas and psoas minor.
No, ma'am, the correct option is levator ani and coccyx. So this is a pelvis, and the levator and this is the levator ani muscle. These are the pair of levator ani muscle, and this is the coccyx muscle, and they together will form the pelvic diaphragm, in which a pelvic organ, that is uterus, bladder, will be there. This is the anteriorly will be urethra, this is vagina, and posteriorly will be anal canal. And it is formed by two muscles, that is the levator ani muscle and coccygeus muscle. Now, which episiotomy type is most commonly used in the UK? Option is midline episiotomy, option B is mediolateral episiotomy, option C is lateral episiotomy, option D is posterior episiotomy, and option is anterior episiotomy. Answer.
Option B.
Yes.
Mediolateral.
Yes, so there are various type of episiotomy, in which midline episiotomy is there, mediolateral episiotomy is there, lateral episiotomy, posterior and anterior. And so the correct option that is commonly used in UK is mediolateral episiotomy. And what are the structures cut in mediolateral episiotomy? Can anybody can answer? Can anybody can answer what are the structures cut in mediolateral episiotomy? So I have already told you that the
Trans-
pelvic diaphragm. Yes, yes, please reply.
Transverse perineal muscles or
Yes,
superficial transverse.
yes. So this transverse perineal muscle and superficial transverse perineal muscle. The Alcock canal contains which structure? Option is femoral nerve, option B is pudendal nerve, option C is obturator artery, option D is sciatic nerve, and option is inferior gluteal nerve. Answer. Ma'am, answer. So the Alcock canal contains which structure? It is pudendal nerve. So I have already told you that from S2, S3, S4 it will arrive from sacral plexus, then it will give branches. First is the inferior rectal nerve and pair of perineal nerves, and this is the pudendal canal, and the pudendal nerve passes through the Alcock canal. So pudendal canal, another name is Alcock canal. The, the corona suture of the skull is formed by which bone? Option is frontal and parietal bone. Option B is parietal and occipital bone. Option C is temporal and parietal bones. Option D is frontal and temporal bones. And option is occipital and temporal bones. Answer. Ma'am, can you answer? So the correct option is
Is
option A. So it is formed by frontal and parietal bone. Yes. So as you know, this is the metopic suture and this is the sagittal suture. So and in between there will be corona suture. So what are the bones that form the corona suture? Frontal bone and the parietal bone. And what sagittal suture is formed by which bones? Ma'am, can you reply that sagittal suture is formed by which bone? Coronal we have already told that it is formed by frontal and parietal bone. So the sagittal suture will form by the, anybody can answer? Please reply, ma'am. Yes, it is parietal bone. This is the temporal bone, so this is the squamous suture, and this is the occipital bone, and in between, so in between the parietal bone and occipital bone, there will be lamboid suture, and in between the two frontal bone, there is metopic suture. So next question is the spinal level of sympathetic innervation to perform lower uterine segment anesthesia is. Option A is L1, option B is L2, option C L3, option D L4, and option E S1. Answer, ma'am. Ma'am, please answer.
L3?
Ma'am, you are not audible. Can you please be clear? Ma'am, please be clear. I am not able to hear you.
Is option
So
B?
the correct answer is L2. So, ma'am, can you please again be or please reply? You are not audible.
I was saying it is L2.
Yes, so the correct answer is option B, L2. As we know that the spinal cord extends from foramen magnum at the level of L2 level. So there are pair of 31 pair of spinal nerves are there, in which 8 pair of spinal nerves are cervical, 12 are thoracic, 5 is lumbar. These are the sacral, that are 5, and this structure, that is the orange color structure, is the cauda equina. And the spinal cord ends at the level of L2, and the spinal segment anesthesia is between L2 and L3 vertebra. Now, before options, next question is, before performing a hysterectomy, which ligament is most important to ligate to control the blood supply? Option A is round ligament. Option B is broad ligament. Option C is suspensory ligament of the ovary. Option D is internal iliac ligament, and option is cardinal ligament. And please answer.
Round ligament A.
No, the correct option is cardinal ligament. And the correct option is cardinal ligament. Now question 17. The androgen testosterone is converted to dihydrotestosterone by which enzyme? Option is aromatase. Option B is 5-alpha reductase. Option C is 17-beta hydroxysteroid dehydrogenase. Option D is 3-beta hydroxysteroid dehydrogenase. And option E sulfatase. Ma'am, please answer.
Is it option C?
Ma'am, you are not audible. Can you be clear?
Option C?
No, ma'am, it is very simple answer question. The androgen testosterone is converted to dihydrotestosterone by which enzyme? So it is option B, that is 5-alpha reductase. Option is 5-alpha reductase. So explanation is that 5-alpha reductase convert testosterone into the more potent androgen, that is dihydrotestosterone. So it is due to 5-alpha reductase enzyme that convert testosterone into androgen DHT. Thank you. I hope you like the class. Please give me feedback that how was the class. Please reply. Please reply how was the class. Should I improve further?
Very nice, quite satisfactory.
Okay, so if you are interested in joining the course, please do join the class, join the course fast as we are starting the course. So hurry up and join the classes fast. Thank you.
Okay. How I will join the course?
Ma'am, already we have provided, so you can already we have made a free group
I
M1 group. So please join our classes and please,
please can you tell me how I will pay?
ma'am, you just ring in this number.
Okay.
I've already told you in the first slide that ring up with this number, that is 8949149861. You join our free group, free channel, pay the price that we have given. Special discount will be provided to you. So please join our classes. And every day
Actually, I joined from the fifth slide. The first slide
ma'am,
I missed.
you are not audible.
Can you please send me the number again?
Yes, ma'am, I will. I'm just showing you the first slide.
Okay.
Ma'am, is the screen visible now?
No, all this thank you all still on my screen. Thank you slide that's only in my screen.
So you can contact on the number 8949149861 if you have any queries. Actually, my slide is not moving. So you can contact the owner and she will provide you the details.
Okay, okay, inshallah. Uh, but only this class, the time was from 7:30 to 9:30. Session closed first.
Ma'am, you are not audible. Can you be please be clear?
I will write.
Ma'am, can you please be clear? Yes, the class